everyone, this presentation covers Chapter 9, Cross-Sectional Studies, in Jacobsen's third edition of the textbook, Introduction to Health Research Methods, a Practical Guide. In this chapter, you will learn that a cross-sectional study provides a snapshot of the health status of a population at one point in time. Here's an outline of the chapter. Section 9.1 is an overview. Section 9.2 covers representative populations. Section 9.3 covers knowledge, attitudes, and skills surveys, or CAP surveys, as some people call them. Section 9.4 covers repeated cross-sectional surveys. Section 9.5 covers surveillance, and Section 9.6 covers prevalence. Section 9.1 Overview. In this section, Jacobsen provides a definition of a cross-sectional study. A cross-sectional study is also considered a prevalence study, which describes existing cases. In a cross-sectional study, it measures the proportion of members of a population who have a particular exposure or disease at a particular point in time. Figure 9.1 covers key characteristics of cross-sectional studies. The objective of a cross-sectional study is to describe the exposure and/or disease status of a population. The primary study question is something like, what is the prevalence of the exposure and/or the disease in a population? The population of a cross-sectional study typically includes study participants that are drawn to be representative of a source population that they come from. So when would you use a cross-sectional study? It may be useful to use the study design when time is limited and/or the budget is very small. A requirement for a cross-sectional study is that the exposure and outcome are relatively common, and researchers expect to be able to recruit several hundred participants. Here are some of the first steps. Number 1, define a source population. Number 2, develop a strategy for recruiting a representative sample. 3, decide on the methods to be used for data collection. Something to watch out for when conducting a cross-sectional study is the non-representativeness of the study population. And the key statistical measure is prevalence, which goes along with terming these studies as a prevalence study. Section 9.2, Representative Populations. Participants should be reasonably representative of one of the well-defined populations. And so what does representative mean? It is the degree to which the participants are like the source population from which they are drawn from. So say we look at the United States. You want to have a sample of participants that comes from a representative population if you are trying to produce estimates that represent the whole country. Section 9.3 covers CAP surveys. So what is a survey first off? A survey is the gathering of data from individuals using a list of questions. This can be done online, this could be done using a sheet of paper sent through the mail, this could be done having someone stand outside and give you a sheet of paper to fill out and give back to them. There are many different ways to distribute and collect data using surveys. But what is a CAP survey? A CAP survey is a survey that asks participants about their knowledge, attitudes, or beliefs or perceptions, and practices, which may also be measured as behavior. Section 9.4 covers repeated cross-sectional surveys. These are a series of cross-sectional studies that resample and resurvey representatives from the same source population at 2 or more different time points. A repeated cross-sectional study design does not track the same individuals forward in time. A new set of participants is sampled from the source population for each round of data collection. Some examples of repeated cross-sectional studies are those that represent national data sets. For example, the National Health Interview Survey is a repeated cross-sectional study where individuals go to people's homes every year, and the Behavioral Risk Factor Surveillance System is a survey that is done over the phone every year. Now, these are done to different individuals, not the same population. And section 9.5 covers surveillance. Surveillance is very important to epidemiology and public health. Surveillance is the process of continually monitoring health events in a population so that emerging public health threats can be detected and appropriate control measures can be implemented quickly. There are two different types, active surveillance and passive surveillance. Active surveillance is the process of public health officials contacting healthcare providers in their jurisdictions to ask how often clinicians are diagnosing particular types of disease. A passive surveillance is the compilation of reports of notifiable disease diagnoses submitted by medical laboratories. Each state has a specific list of conditions that need to be included as part of passive surveillance, as well as the CDC requires some passive surveillance nationally. In section 9.6, Jacobsen covers a little bit more about prevalence and some of the different types. As a reminder, the prevalence is a percentage of members of a population who have a given trait at the point in time. A point prevalence is defined as the proportion of a population with a particular characteristic at one point in time, whereas a period prevalence is a little bit longer but still considered a prevalent study. It's the proportion of the population with a particular characteristic during a defined time period, such as several weeks or several months. A prevalence ratio is a comparison of those prevalence estimates. It's a comparison of the prevalence of a characteristic in two independent populations or independent subpopulations that is calculated by taking a ratio of their prevalence rates. A cross-sectional study has no time dimension, so it cannot be used to assess causality. This is very important when conducting a cross-sectional study. You can say that an exposure is associated or related to a disease or a particular outcome, but in a cross-sectional study, you cannot say that that exposure caused the disease. Okay, so that is it on Chapter 9 on cross-sectional studies. Thank you for listening.